Hi, good afternoon, everyone. Welcome to the Greater Vancouver Chamber of Commerce's online workshop, Mind What Matters. I'm Janet Konevsky, the Chamber's Vice President of Membership and Operations. Thank you all for joining us this afternoon. When creating programming for 2020, we anticipated kicking off the year's workshops with experts of human resources, interpersonal skills and communication, marketing, and equity. And now we have the opportunity to bring experts in healthcare to discuss safe approaches to adaptations we're all implementing during COVID-19. The Chamber is excited to host PeaceHealth as our expert panelist for this Mind What Matters webinar on health and safety. Joining us today is PeaceHealth Director of Infection Prevention, Catherine Kroll, and Executive Chief Sean Gregory, who will apply a research-based evidence on best practices for safe business reopenings and how workplace around our region can maintain updated safety measures. If you have not submitted your questions ahead of time, please feel free to send them in the questions box located to the right of your GoToWebinar screen. Please note, if you're joining us via phone, you may not have this function capability. Without further ado, I'd like to welcome Sean Gregory. Since 2017, Sean has served as the Chief Executive of the Columbia Network, overseeing PeaceHealth hospitals in Vancouver and in Longview. Prior to joining PeaceHealth, Sean served as the Chief Executive Officer of Health First Homes Regional Medical Center in Rockledge, Florida. Sean holds a Master's of Hospital and Administrative Healthcare Administration and Master of Human Resource Management and Organizational Development from Washington University in St. Louis, Missouri, and Bachelor of Business Administration Finance from Texas A&M University. Sean, welcome.
Thank you, Janet, and hello, everybody. I wish we could see you. I apologize, I don't have great lighting in here. But Catherine and I were excited to get a chance to share with everybody today what we've learned. And I was going to share a little bit from a leadership standpoint, what's working well and what hasn't been working well. And then Catherine's really going to Catherine is very much an expert in her field. And I think you'll find what she has taught us and what she will teach all of us this afternoon very helpful. So first of all, a little bit about PeaceHealth. We, as many of you know, we're the largest employer in the region. We do a lot of work in our hospitals, but just to give you a little comparison, today we are taking care of 500 people in their homes for both home care and hospice. So we do a lot of work outside the hospitals too, that being one example. And as you can imagine, we've had our hands full trying to keep people safe, both patients safe as well as our employees during the last 90 days. And before Catherine gets started, I just want to share that I feel so grateful that we have really been successful in avoiding workplace exposures for employees, as well as getting patients infected while they've been at the hospital. So that's been a huge win for us. And Catherine's going to share a little bit of how we've done that. Some of the statistics you can see here, we have discharged about 54 patients from the hospitals over the last few months. One of the questions I keep getting right now is how are some of the recent trends in the community looking? And that is not so positive. We, for about a week, we had no patients hospitalized in Clark County for COVID-19. And now, unfortunately, we've got 11 patients in-house here, and I think a few at Legacy as well. So we are seeing a little bit of bump back. That's nowhere close to where we were a few months ago, but it's something I think to keep all of us on our toes. And I think the healthiest perspective for all of us to have, based on what we've experienced and what we've read, is how can we help our organizations be successful with COVID, not necessarily when are we not going to have COVID. And I guess I feel like PeaceHealth is a living testament as to we can do our missions outside of COVID with COVID. And I think that applies to your organizations, and Catherine will very, I think, effectively articulate how we're doing that here. So with that said, Catherine, if you could jump in, and then we're excited also to have some questions and answers once Catherine gives you a more detailed update on what we're doing. So Catherine, I don't want to steal the show from you.
Thank you, Sean. So I appreciate the opportunity to be here. I think that as an epidemiologist, I've been training since I was 10 years old. And preparing for a pandemic. And I don't think that I ever actually knew what that was going to be like, because when I was thinking about training and preparing for it, it was going to be this rush of an epidemic, and we were going to figure out right away how to stop the spread of it. And in 2 weeks, we'd have it under control and move on. And so this is certainly a once, I hope, in a career experience for me. And I'm thankful for the opportunity to be able to share with you some ideas on the business side of how we can partner and what that might look like in keeping people safe in your businesses, so that you can resume as much as back to your pre-COVID operations as possible. So with that, I'm going to start off today and just talk about what do we actually know about COVID. The symptoms do vary, but they almost always include some sort of respiratory symptom, and that is cough or sore throat, often fever, but not always, chills, muscle pain, sore throat, loss of taste or smell. So that's something that it is a little bit unique with COVID, and we don't see that with a lot of other disease processes. And so that's one of the early symptoms, and actually it looks like having that as a symptom is a good predictor for a positive outcome for the patient. It's something that we have been asking our healthcare workers as part of our symptom screening to make sure that they have not lost taste or smell, because that looks like actually one of the earliest symptoms that you can see. But then there are other symptoms that are less prevalent. They're nausea, vomiting, and diarrhea. So it can run the gamut, and you can't know if you have COVID without being tested, because there are many other diseases that have very similar presentation. And so if that's one thing that you can take away from this, is symptoms alone don't make COVID, and presuming that you always have the virus and that you're always capable of shedding it is the best way to prevent from spreading to other people, because you've got that at the front of your mind, and keeping others around you safe and encouraging them to do the same for you. There's a lot out there in the media about the different ways that it's theoretically spread, but what we know from a science-based standpoint is that it is mostly spread through droplets. And droplets are coughed out or breathed out into the air, and within 6 feet they drop out. They're heavier particles, and so they don't stay aerosolized. There's been a lot in the media about other situations that are kind of one-off situations in terms of ways that it's spread, and asymptomatic super spreaders, and interesting articles have been published on that. But at the end of the day, what we know is that most people who come down with COVID come down with it because they were in close, prolonged proximity to someone who is symptomatic. And so close, prolonged proximity looks like 15 minutes within 6 feet of someone who's actively spreading the virus. So when you're hearing about all of these other situations, I call that kind of the what if. There's all of these different ways that COVID could be spread in really unusual circumstances, but it's the 80-20 rule. We need to put our prevention resources into the buckets that we know are the most likely ways that it's going to spread, and address those first before we start looking at all of the other one-off type situations that could spread it. The great news is that we can reliably test for COVID here in Clark County. We are fortunate to be able to test in the community. There are many clinics that are able to offer point of care testing, and then there is also PCR testing. The thing to know about testing for COVID is, just like any other disease, not all of the tests are the same. So, and the effectiveness of those tests really impact whether or not you're going to get the right result, and if that result is going to be clinically applicable, or for you from a business standpoint, if it's going to yield the information that you need to protect people. So the best test that we have is one that amplifies the genetic material, and you'll hear that called the PCR test. The other tests that, especially about 6 weeks ago, got a lot of negative press were the point of care tests. And what we've found at PeaceHealth, and we actually just published some literature on this based on our experiences, those point of care tests have a really great applicable in when they're used just before someone starts having symptoms and within the first few days after having symptoms. If you are more than 3 to 5 days from the onset of your symptoms, those point of care tests have a lot of false negatives. And I think that that was really scary to see the headlines that were published of that really kind of denigrated the test as being not useful. The test is useful when used in the appropriate situations. But if you've been symptomatic for several days, that test has a high likelihood of giving you the wrong result and not showing that you're positive. And so that's why we have moved within PeaceHealth to only using the PCR test for people who are symptomatic and suspected to have it. We've been using the point of care test in a different way, which is to assure that we know the status of everyone who is coming to be inpatient in our hospitals or that is going to have a surgical procedure. So we use that test to let us know whether or not someone could be pre-symptomatic or asymptomatic carrying it. And then we're able to assure our healthcare providers that they are not being exposed to it. If we say someone doesn't have COVID, they truly don't based on those test results. The testing for PCR, the turnaround time can be challenging. There is widespread capability for testing with the PCR at reference laboratories. We use a reference laboratory up in Bellingham, Washington, and so the turnaround time is you have to come, be tested for it, and then have that sent out to a reference lab. And we use that for patients who are in the outpatient setting who can be sent home and asked to isolate until we know what their results are. In the inpatient setting, we have some limited tests availability that in 90 minutes we can know if someone is symptomatic with COVID, we can know whether or not they're positive. And so we've been really reserving those tests to help us make decisions on isolation in the hospital because there's such a limited amount of that. And we expect that limited amount to continue to be available. In a perfect world, we would have that 90-minute turnaround for anyone who is symptomatic with COVID, both in the outpatient and in the inpatient setting. Unfortunately, the reagents levels are not available. So everyone can buy one of these testing machines, but getting the reagents that you need, the chemicals that you need to be able to perform the test is still on allocation. And so right now we have enough to test those people who are symptomatic that are sick enough to need hospitalization, but there isn't enough reagent available in the communities to test anyone who's symptomatic. Those are available to be sent out, and that's why you have a longer turnaround time. So with the length of time, turnaround time, that's a really important piece for us to continue to try to reduce that. And we are working really closely with those lab partners. We've been calling it our Pony Express route. So we are physically driving and have increased the number of routes that go up every day. And we're getting really quick turnaround time. Within PeaceHealth, most of the time, we're under 36 hours from the time that it's collected. So that's great news as well. Because the quicker that we can find out if someone has disease, the quicker that we can report that to our public health partners who can then start the contact tracing. And the quicker they start the contact tracing, then they know who has had close, prolonged contact with that person who's positive, and that they can ask them to home isolate. And so that's how we're going to interrupt that chain of spread. So locally, the lay of the land in Washington, you can see that on the bottom of this, it looks like, gosh, we just haven't had that many positives. And certainly we've been really fortunate in Washington to not have a day where we had more than 1,000 positives resulted. But I think what's really useful to look at on this graph is the testing capability. So you can see with this blue line, we have had consistent testing capability really since mid to late March. And that was when a lot of these labs got up and going and were able to test anyone who's symptomatic. So when people are asking me, like, how should I look at the data and how do I interpret the number of positives? We've consistently been able to test people who were hospitalized with COVID-like symptoms since early March. And that's the data I look at to determine what the severity is. And as Sean mentioned earlier, gosh, we went almost a week with no one who was positive inpatient, and then had an incredible jump in the number of positive inpatients. So people who were sick enough to need hospitalized. And as we go along and have the testing available in the community for a longer period of time, I think that that outpatient testing data will also help us know where we're at. But that just has not been available long enough for us to use that for trending. So I always recommend that people look at the hospitalization data rather than the full testing data to get a picture of the burden in the community at this point. Locally in Clark County, you can see that we've had some certain spikes in the epidemiology world. We call these point prevalence spikes. So obviously, early March, we didn't have a lot of testing available. Then the testing became more widely available. And by the end of March, we were starting to see some of our highest days. And then we really had fantastic results with the stay-at-home and shelter-in-place work that was done. And so from mid-April until late May, we didn't start seeing spikes again. Once people started gathering and socializing, we started seeing those spikes again. And the early spikes we saw were often in the elderly and in community or congregate living settings. Now that we've really done a great job as a community of making sure that spread is not happening in those congregate living settings, the spikes that we're seeing are community spreads of it. And that makes us worry because that means that the virus is out there and being able to be passed from person to person within the community in a way that it was not being passed from person to person for about 6 weeks from April until the end of May. So what do we not know? We don't know about the next wave. We could continue at this kind of slow and steady pace. And as an epidemiologist, that's really kind of my hope for us, is that we have the slow and steady pace that doesn't overwhelm our healthcare facilities, and that we are able to see hot spots of spread and effectively treat those hot spots in the same way that you would a fire, which is turn our hoses on, get our resources, and not have to do widespread shutdowns again. My biggest worry would be if we went all summer and had very few cases, that as the respiratory season, influenza season starts up in late October, that we would see a tremendous spike in cases at that point in time. And that would be followed by high hospitalization rates and overwhelm our capacity to care for those patients. Voluntary contact tracing is really going to be a key part of this. And so encouraging you as businesses to have a plan for how to incentivize that voluntary contact tracing and participating. Quick turnaround. If you have an employee who tests positive, that you're encouraging them to get into contact with the public health department as soon as possible, that they have to compile a list of people that they know that they had close contact with and get that list to public health so that the contact tracers can immediately start reaching out and notifying those folks and putting into plans to keep them safe from spreading it. The other thing that is just a big unknown right now is what happens after infection. Certainly, we all believe in the infectious disease world that there's a level of immunity that is granted to you right after infection, but we don't know if that immunity lasts. And we don't actually have great serology testing yet. And as serology becomes more widespread, looking for immunity, what we're saying is we can tell that you were likely infected with COVID-19. That's what a positive serology test tells us. It doesn't tell us if you can be reinfected with the virus. And it also doesn't tell us if you're going to have lifelong immunity from the virus or sustained immunity over time. You can compare this to the measles, which we had an outbreak of last year in Clark County. Measles infections, we know based on years of research that an infection with measles, you come out of that and you basically have lifelong immunity from measles. And then if you contrast that to something like influenza, where there are so many different strains of it, that an infection with influenza may protect you from being reinfected with that exact strain, but other strains that are genetically similar but just different enough that your body can't recognize and kill them before they cause infection. And that's what a lot of us are really concerned about as we move forward is what is this virus going to look like? And is it going to behave more like measles, or is it going to behave more like influenza? So I know that you're all here because you want to know, how do I safely get back to business? And there are 3 really key points that you have to address to get back to business safely. The people who work for us have to feel safe at work. You need people to come in to work so that you can have customers who also then you need to work with so that they feel safe patroning the business. And then we need to be able to inspire confidence in our government partners of not being the source of spread. So having really solid plans, written plans in place for your business, and procedures and policies that are specific to COVID. When we think about creating a safe workplace, I think that there's the practices that are really important that you have to start from. And best case scenario, we all have to give ourselves some grace around this. This is unlike anything we've ever worked through in our lifetime. So working from home, if that is something that can work for your business model, working from home is absolutely the best thing that you can do, because then your workplace isn't going to be the source of spread. Virtual meetings like this, just rethinking how we use some of these online platforms and how do we do that. So for instance, I had an online appointment with a stylist at one of the local businesses here to purchase some clothing. I hadn't been able to go into a store to shop, and I still don't feel incredibly confident that the business plans that were in place to be able to go into the store and shop. But what I felt really confident about was doing an online consult where someone held up different pieces of clothing and I said, yeah, gosh, that looks like something I'd like. And then I was able to go pick them up from the store, return the ones that didn't fit right, get different sizes. So think about those models and how can you make these virtual platforms work for what it is that you do business in. If you do need to have people in your office because of your business and the way that it works, masking at work is going to be essential. And I will tell you, I'm a scientist and data changes my mind. And I was initially had some real concerns about universal masking because I thought this is going to be a real challenge. People are going to accidentally self-inoculate because they're not used to wearing masks. So they're going to do things like touch the outside of their mask and then touch their eyes. And in doing so, they're going to completely negate having had that mask on. And I was concerned about that. But the data is in and it works well. So within healthcare, I've been partnering with infection prevention directors from across both the metro area and the state of Oregon and Washington. And what we found is that we were having transmission among healthcare workers who were coming to work who weren't actively highly symptomatic, but they didn't quite feel right. But gosh, is it allergies or is it COVID? And so they had come to work and there was spread among healthcare workers from person to person. Since implementing the universal masking within PeaceHealth, we have had no spread from person to person for healthcare worker. And we have had no spread at all in PeaceHealth from a healthcare worker to a patient. And we have tracked that very closely, that anytime someone has come down with COVID, we go back 72 hours from the time that they think that they felt started feeling poorly, because we're concerned that they might have been pre-symptomatically shedding. And we have not found a single time where we have spread COVID to any patients from healthcare workers. And since universal masking, we've had no spread from the healthcare worker to healthcare worker. So that to me really highlights that masking actually does work. And so now I'm a huge proponent of it. Whereas going into this, I definitely had some skepticism. Also thinking about the physical setup. Masking is important, and masking when you're at your desk is not necessary if you're able to keep that physical distance from other people. But what you have to know to do is handle those masks in a way and have a plan for when do I need to mask at work and when do I not need to mask at work. And your physical setup is going to be a really important part of that. Also thinking about if I need to have in-person meetings, how do I do that safely? And so measuring out in your conference rooms, how many people can you safely put in your conference room who are masked? Well, the CDC guidelines suggest both masking and keeping 6 feet apart. So how many people can you put in your conference room safely? And do you have a limit? We have a joke here at PeaceHealth at our system office of we have one in-person meeting a week, and we all come in, and you don't want to be the last person because you'll get sent back to your office and you have to attend the meeting virtually, because we can only fit 10 people safely in that conference room. So think about how many people can you safely fit in your conference rooms, and posting that information and making it very clear that we're not going to exceed that for any situation, and that the expectation is that even when you are 6 feet apart, you continue to keep your mask on in those scenarios. Break rooms are another big piece. We all need to be able to eat. And so thinking about how am I going to do breaks at work, discouraging use of break rooms if you can, eat at your desk, those type of scenarios. But if you need to use a break room, what are the rules in the break room? How do you assure that your break room, like your conference rooms, people can maintain masking when they're not actively eating, and that if they are actively eating, that they're keeping at least 6 feet from other people, and that people are not at all symptomatic when they're there. High touch cleaning. This keeps coming to me as a question of, Catherine, how do we kill the COVID virus? It must be special, and it's not. COVID is pretty easily killed in the environment. It can live on surfaces for 2 to 3 days. What we don't understand is it viable from those surfaces? So how long can it stay on a surface and you come along and touch that surface and then touch your mouth or your eyes and get that? But what we know is that it can live for up to 3 days on these surfaces. And so high touch surfaces, rather than developing these really comprehensive, get in every nook and cranny cleaning plans, what businesses need are high touch surface cleaning plans. So making sure that those surfaces that people are often touching are getting disinfected frequently. And if it's between customers or if it's in a office workspace like a copier, what is the policy and who's responsible, and making sure that it's really clear who's responsible for doing that, and that cleaning is all of our responsibility. When we're looking at policies to minimize this risk, we also need to look at policies that are for if someone has a known exposure to COVID. So they're going to be asked by public health to stay home for 14 days. And the same if they travel to a hotspot, and not just international travel, but local to the United States travel. Right now, there are certainly other countries in the world who have quite a burden of COVID and some challenges, and traveling to those countries puts people at risk. But traveling within the United States to hotspot areas, and those areas are kind of constantly changing. So knowing the local data and making sure that people are given the opportunity to work from home for 14 days after they do that travel, especially if that travel is business related. Also thinking about for business related travel, if you have someone, for instance, that has to go to the state of Alaska, right now the state of Alaska requires people to be tested within 72 hours of travel. And so if you want them to be able to conduct business shortly after landing in Alaska, they need to be tested before they get on that plane so that they can maximize their time in the state. Otherwise, they're going to be in a situation where they arrive and they have to wait until the testing at the airport that's available comes back, and that can be 3 or 4 days. And so you lose that time. So think through and think about locations that people might need to travel to for your business and how you're going to handle those locations, and have a written plan for it. Break room, again, thinking about the break room policies, making sure that people understand using that, and if it has to be, those spaces need to be used, how many people, and making it just very visible and clear what the expectations are. Resources that I have really appreciated from this is the CDC Business Toolkit. So I think that there's a lot out there, and there are many people who are hypothesizing the different ways that this virus could be spread and the different things that you should or shouldn't do in a workplace. CDC has the best, most comprehensive checklists, and they can be tailored to your business, and they help you make that written plan. And that's also going to really help you if you have an exposure. And I guess I shouldn't say if, but when. I think that all of us can expect that people who work with us at some point, someone we know is going to either have COVID or have an exposure to COVID. And so knowing what to do in those situations ahead of time, and also having that available so that when public health calls you and says, someone who works for you tested positive for COVID, tell us about your plan, that you're not scrambling, but that in the moment you can pick up and say, here's my plan, here's what we've been doing. And that's going to grant you and buy you some goodwill in those situations of you don't have to be scrambling in the moment to come up with a plan for safety. You already have had a plan for safety and you've had that implemented, and it will help public health help you know which employees need to work from home for 14 days and what truly exposures happened within your business. The Washington reopening guidelines also have some really nice examples and safety metrics that are being recommended. There's always room for common sense and infection prevention in the transmission of diseases. So I think using that science-based approach and taking that and applying it to your business is going to be a key part. So limiting the spread within your business, preventing people from working sick. Working sick is a pervasive part of the American culture, and there are all of these ideas that get thrown out, but having PTO doesn't necessarily mean that people won't come to work sick. So having the availability to have paid time off is important, but it's not the only thing. People most often in this study that was done in the Robert Half survey cited that they came to work sick because they didn't want to let other people down and because they didn't want to have that burden be there. So giving opportunity for people to say, gosh, you know, you're an important part of our team and what you bring to the table is great, but we also need you to stay home when you're not feeling well, because that's putting our business and your coworkers at risk. And that's cultural in America, and that's something that we're going to have to change in this COVID so that people do not come to work sick and make workplaces a place of spread. The other thing that you need to think about is how are you going to screen your employees and what's that going to look like? There are different mandates depending on what business you're in about the level of screening and how that's coming down. There's question about should you always screen for temperature every morning? Certainly in the healthcare setting, we are doing that. At this point, it is not mandated in many other business settings, but there is the opportunity to know what symptoms should I be looking for and use that daily to remind people and to think about what symptoms they have. And if people have symptoms, making sure that you have somewhere that you can refer them to for testing. And considering covering that testing. Within Clark County, there are several places that can do that 1 to 2 day turnaround time for testing. PeaceHealth is just one of the many partners locally that can do that with you. But having a plan and knowing ahead of time so that you're not wasting precious time trying to figure out where to refer someone to for a workplace exposure or someone who's sick, and knowing within your businesses, well, where is it being covered and by our health plan, so that you can make sure and get people effectively tested in the shortest amount of time. So a communication and a plan for when you have a positive. I think that, again, you have the plan in terms of what you're going to say to public health when they call you, but also a plan for what you're going to say to the folks who work for you and how you're going to prevent panic. The last thing that anyone wants is someone to find out via social media that there was an exposure at their workplace. And so I think that really having a good plan for how to quickly and effectively communicate that there was an exposure so that you can control that messaging and also highlight the safety things that were in place that would have prevented spread, so that that can give people peace of mind to continue coming to work even when there's been an exposure, assuming that there's not high risk situations that are involved. So I want to end with just looking at the future. I don't have a crystal ball, and certainly 10-year-old me thought that pandemics were going to last 2 weeks and we would have sorted it out and gotten it all taken care of. But a window into the future is thinking about how are you going to do this, your business, for the next probably year until we have a vaccine, because that's really what's going to get us back to pre-COVID activities. And so having an idea of in the next year, what am I going to do to adjust? Because I don't think that any of us feel like going into shelter in place for a year is feasible from an economic, from a mental health, from a social standpoint. And so coming up with new ideas and ways to celebrate and to be in your community and in your business. So for example, last weekend, my fiance had a pretty big milestone birthday. And so I threw him a drive-by socially distanced party. And I am really used to asking people to mask in my community for work, but it was a much different experience for me to do that in my social circle. And for the most part, I put out expectations ahead of time, but there were a couple of folks who showed up who didn't have a mask on. And how we approached that was we had masks available. And I think that this is going to be how you're going to need to approach this with customers, is setting expectations with your customers around masking, because the future definitely looks like masking for the next year until that we have a vaccine. And so that until that's available and we can protect people, we need to protect them through mechanical barriers like masking. So when these two folks showed up at our party and they didn't have masks, I said, oh gosh, we've got masks right here, here you go. And rather than approaching it and saying, you aren't masked and that's not acceptable, and that doesn't work for my party. Also, I'm the director of infection prevention for PeaceHealth, and I can't be on the front page of the newspaper for having started an outbreak of COVID. We approached it as here's a mask for you. And so think about, how are you going to support the people who work for you to set those expectations with customers? How are you going to reach out to your customers and let them know what your expectations are for business, so that you can avoid some of those tough conversations? And then if people aren't able to mask, think about other things that will help protect. I am a fan of face shields if masking is not there. Masking is better than face shields. It holds in the droplets better. But if someone truly can't wear a mask for their health reasons, such as someone who has asthma and is unable to mask, having alternative options available for those customers to help keep them and your employees as safe as possible is going to be really important. So that's a big part of what I see going into the future. The other thing is understanding the role of serology. I think that it will be really important, and that by probably next fall, we will understand whether or not being infected now gives you immunity for a longer term. So when we get that information, it's possible that we'll be able to make employment decisions and masking decisions and some of those things based on that serology. But we've got at least probably 6 months before we're truly going to understand that better. Vaccines take a long time to come to market, and that's our next best strategy for preventing the spread of this outside of those mechanical barriers like masking. And when a vaccine does come to market, it will likely come to market, and high-risk folks will be the ones that are offered the vaccine first. And so it'll come in waves. If you remember back in 2008, 2009, the influenza pandemic that happened, similar to that, but we were able to get a vaccine much quicker because we knew how to create influenza vaccines already. It was just a matter of getting that strain. So now we're learning how to create COVID vaccines. We're going to need to do trials, and it will probably be next summer before we have a vaccine available. And then going from there, making sure that that vaccine really truly works and is viable. And this is an RNA virus, and RNA viruses are what we call in the world of infectious disease promiscuous viruses, in the sense that they change out their DNA or their RNA, their genetic material, often. And so that capability to change that out makes the virus more like influenza. And so we could end up with multiple strains and need annual vaccines. It could be that every year we get both an influenza and a COVID co-vaccine. And we don't know that for sure yet, but that's certainly something that we're tracking closely in the world of infectious disease epidemiology. The last thing I want to end with is just a message of hope around the respiratory virus season. So if we can keep these mechanical things in place and prevent the spread, the same thing that prevents the spread of COVID prevents the spread of common cold, of influenza, and all those other respiratory diseases. So my hope is that actually next fall, if we're able to follow these, that we will have lower rates of influenza hospitalization and lower burden of influenza out in the community, because we're using that, and that we're addressing a hand hygiene and respiratory model. So I'm hopeful that that can be a positive outcome for all of this work that we've had to do this year. So with that, what I'd like to do is transition and give you the opportunity to ask questions for things that we didn't answer in this presentation. And then, of course, I'm always available for follow-up. I'd love to have conversations about this. It's been a great opportunity to be here, and thank you so much.
Thank you, Catherine. As Gregory or Sean joins us, I'm going to remark on a couple of things. We do have a couple of questions, but I think one of the key takeaways for me, as we look at re-entering the workplace, we know that a lot of our employees are very loyal, and a lot of businesses around the region have been struggling. So knowing that those employees don't want to let down their boss or let down the organization, because it means a lot, right? The reopening and getting back on track. So making sure that communication with employees was a good takeaway for me. If you're sick, don't show up. You're not doing us any favors, and making sure that we voice that over and over again. It's both good and bad, right? Great employees with a lot of great work ethic and wanting to help out an organization, but in the long run, it could end up hurting the organization. So we do have a couple questions. One of the questions is, what is the actual recommendation when you're returning to work after you have already quarantined after a positive?
So after a positive, you can come back to work. The CDC guidelines are that you can come back to work depending on the test that happened and your symptomology, but most often you can return within 10 days of that positive test. What we're looking for is that you have a decrease in symptoms and that you're feeling well. Most of the literature that is coming out now is showing that basically after 7 days onset from symptoms, you're very unlikely to spread it to others. So we still are at that 10-day mark in terms of recommending returning to work at this point, but that could change as more science comes out. And it's still going to be really important that you continue to mask when you come back in case you're the one-off that has sheds the virus longer and is potentially contagious to your coworkers.
So Catherine, one thing that you said that I think is important to reinforce is we have been using this CDC as our source of truth. And I think it's important to say it because the CDC has a community health perspective that's nonpartisan. They don't come at it with an agenda to approve. It really is based on the science. And I think for all of us as business leaders, it's really important that we latch on the right source of truth. I mean, if you have a hypothesis, there is certainly an organization that can help you prove it out there. And we found it helpful to kind of consistently stick to the CDC guidelines when we have questions like that come up.
Right.
Yeah, and that's what our public health partners expect. And so if you're following the CDC guidelines within your organization, when you have an exposure, that's going to really help you reopen as quickly as possible following the CDC, because that's what they're going to be asking you to have followed.
Okay, great. Thank you for that. We do have a small boutique in town that has a question on reopening. And is it advisable to just test all of her staff upon reopening to see if there is any potential spreader?
You know, that's a challenging question because testing gives you an insight at one moment in one point in time. And so certainly if that makes you as a business leader feel better about it, but what you have to know is that 2 hours later, if that person had exposure, 2 hours later, they could come up positive. And so you only know at one single moment in time that everyone's negative, and that that can be useful in some settings, particularly in healthcare settings where you're having close personal interactions with highly vulnerable patients. It's probably less useful in other settings because it gives you a false sense of security, and that it would be better to really focus on those mechanical barriers and making sure that those are in place so that if that person does start shedding virus and then having symptoms a couple days later, that you've had all of those things in place that would have prevented the spread before that.
Great. One other question is regarding disinfectants. So a lot of the disinfectants are saying they kill 99% of all germs and bacteria that people are using in the businesses. But now there is a dialogue out there that they don't instantly kill and that it takes some time. Are there any recommendations?
Yeah, so what you need to look at is each disinfectant is required to put on its kill time. And so you have to look at those and look and see. There are some, especially a lot of the less expensive disinfectants, where they have a wet kill time of 10 minutes. And that's probably not going to be what you want for a surface that needs to have quicker turnover. If it's at the end of the day, a 10-minute kill time, that's okay. But if you're trying to reuse that surface between clients or customers, you want something that has more like a 60-second kill time. And so looking for those that have the 60-second kill time and a claim, there's an FDA list of disinfectants that are approved for killing coronaviruses, and that's what you're really looking for. This is not a special virus in sense of it's not difficult to kill in the environment. It's just a matter of what type of disinfectant are you using and how much contact time does that disinfectant need to have.
Perfect. And I see one last, actually there's a couple more coming in. In a non-healthcare business setting, do you recommend air purification systems such as a bipolar ionization?
There hasn't been any literature or evidence that those really help. We are not using those even in a hospital setting. So that would presume that those viruses hang in the air for long periods of time. And certainly in healthcare, we do some procedures that are called aerosol generating procedures. And if you do something in your business that would be aerosol generating for respiratory secretions, then you want to have a plan for letting those areas sit for a longer period of time so those aerosols can come out of the air and be cleanable off of a surface. But there's been no evidence out there that you need one of those type of things, but there has been plenty of companies who are trying to sell people those.
Right.
And Janet, I think that also gets back to that, really, that our emphasis on the CDC recommendations. And some might say, well, is the CDC acting quick enough, or is there innovation? We found the CDC is acting very agile in adjusting their data and their recommendations based on the science. And there are so many folks with so many different agendas that every day you have somebody come up and say, hey, I heard this is going to work. We tend to say, hey, let's see what the CDC or other folks that we're really relying on say before we jump to conclusions.
I think that's one of the reasons the Chamber is really excited to partner with PeaceHealth, because we can dispel those myths. People have an opportunity to ask questions and really get a science-based approach to some of what they're hearing out there, because we're certainly hearing a lot, right? Everywhere we turn, recommendations. So Sean, that's a really great point. We have one more question that's regarding, actually, this might be a good one for quite a few businesses that have upholstery. And is steaming upholstery an effective way to disinfect, and is it needed?
So it certainly is an effective way to disinfect. There's not been great evidence that these viruses are easily spread from some of these upholstery type surfaces. The viruses tend to be more easily spread from a surface that is harder and less porous, but certainly there are many diseases that can be spread, and so using that on the upholstery makes a lot of sense. And that is especially CDC's recommendation around when you have something like a norovirus outbreak, using the steam to sterilize those upholstery and to clean that makes a lot of sense. And so we would recommend the same with coronavirus.
Perfect. And one last one, 6 feet away, where we're hearing 6, 9, 12 feet. Can you break that down? Is 6 feet the bare minimum? Do you recommend going further? We talked about droplets early on. You started the presentation off. Assuming everybody's wearing masks, that might change. Can you talk about that?
Yeah, so the masking and 6 feet is great. So you don't, some people have taken the, well, if 6 feet's good, 10 feet's better approach. And certainly if someone is symptomatic, I want to be as far away from them as possible. But in the general interactions, that those over 90% of those droplets fall out within 6 feet, and that's when someone's unmasked. So if they're masked and you're within 6 feet, that's really a pretty good indicator. I think that the only time that there's a recommendation around being further from someone is if those respiratory aerosols are happening. So if someone can't be masked for some sort of medical reason, that might be a time where it makes more sense to be farther away, because if they sneeze, we've probably all seen those videos that give you the heebie-jeebies of the sneezes that go clear across the room. Like, yes, that can happen, but the vast majority of the time that doesn't happen. And if you're masked, that's all staying inside. One thing I didn't mention is having a plan for masks so that they don't become vectors for transmission. So, and also thinking about, how do I keep my mask clean? So encouraging employees to have more than one mask so that they can trade them out during the day, especially if you're constantly needing to wear it. They can get wet and be uncomfortable to wear. I've seen a lot of folks, yep, Sean's got his several masks. I've seen a lot of folks who have had like skin integrity issues and breakouts on their face because they're wearing that wet fabric against their skin. So it would be better to trade those out often throughout the day, and not, I recommend having 3 for an 8-hour shift.
So the other thing, Janet, that's important for us as a community, the more we can all take a consistent stance that let's stick to 6 feet. We are dealing with thousands of customers a day right now. And the more we're consistent and what we say, the better. And people understand. that, you know, there are outlier opinions and people that are way extreme on one side or the other of how we keep ourselves safe. But what we found is 95+% of our customers and patients really do understand the 6 feet, the masking. And for anybody that's on the phone that's really living in fear about how are people going to respond, when I think you'll be pleasantly surprised that most people are reasonable if we all approach them in the right way. And we stick to consistency and 6 feet versus 9 feet or 12 feet, or that's why we're kind of pointing everybody to the CDC.
Great. Perfect. Well, thank you. Thank you, Catherine. Thank you, Sean. We appreciate it. And we appreciate the work that you guys do in the Southwest Washington region. It's pretty impressive. And I think contribution, the investment you make, not only in the business community as far as the chamber is concerned, but in the community as a whole. And what people might not recognize is the work that you guys do behind the scenes at other offices and other homes to make sure that they're trained and not spreading. It doesn't just happen within the confines of your hospitals and your clinics. So that's appreciated. We are going to wrap this up. I do want to let people know that we are recording this, and this will be placed on the Chamber's YouTube channel. So if you've missed something, if you want to take a look at the slides, that will all be preserved and can be viewed at any time. We will be continuing with the Mind What Matters workshops via webinar. And next week, we actually are going to be joined by experts at Mal Foster and Alon G, who will be working with those of us who have opened up already and those that might be opening up in the next couple of weeks, really to understand what that phase 2 means at a state and a federal level, so that we can look at the requirements that are being placed on the businesses and what the businesses can do at the policy level to make sure that we're in compliance, and how to navigate all the resources that are out there. So hopefully everybody will come back and join us next week, and we'll continue these. Catherine, Sean, again, thank you very much. We appreciate it.
Thank you. Have a great day.
Bye.